am very happy to have this opportunity to tell you about medical records. Then when you admit your patients to the hospital, you will better understand the requirements and why this information is required. Since dentistry is an essential part of total health care, more and more patients are being admitted to the dentistry department or on the dental service. Whether or not the dental service is an organized department or not, the following requirements shall be met. 1. Members of the dental staff must be qualified legally, professionally, and ethically for the positions to which they are appointed. 2. Patients admitted for dental services may be admitted by the dentist either to the Department of Dentistry or, if there is no department, to an organized clinical service. 3. There must be a physician in attendance who is responsible for the medical care of the patient throughout their hospital stay. A medical survey shall be done and recorded on the patient's medical record by a member of the medical staff before dental surgery is performed. Purposes of the medical record are: 1. To serve as a basis for planning and for continuity of patient care. 2. Provide a means of communication between dentist and physician and any other professionals contributing to the care of the patient. 3. To furnish documented evidence of the course of the patient's illness and treatment during each hospital stay. 4. To serve as a basis for review, study, and evaluation of the care rendered to the patient. 5. To assist in protecting legal interests of the patient, hospital, and the dentist. 6. To provide data for use in research and education. All significant clinical information pertaining to the patient should be incorporated in the patient's medical record. The record should be sufficiently detailed to enable the practitioner to give effective continuing care to the patient, as well as to enable him to determine at a future date what the patient's condition was at a specific time and what procedures were performed. 2. To enable the consultant to give an opinion after he has examined the patient's record. 3. To enable another practitioner to assume the care of the patient at any time. Patient medical records should include the following: 1. Identification information such as the patient's name, address, age, sex, and next of kin. There should also be consent form or surgery. This must be an informed consent. In other words, be sure to explain to the patient what type of surgery you can do, what you hope to accomplish, but forget to explain any risks that may be involved. This consent must be signed by the patient, or if the patient is a minor, then one of the parents must sign. One of the other reports we find in the patient's record is a health examination. This record should incorporate the complete details of the illness, symptoms, past history, social history, and family history. It is responsible for his field and write the dental history and physical and its implications on the patient's general health. The history should be a record of information provided by the patient. The patient's chief complaint should be stated in a concise manner. The physical examination should include all pertinent findings resulting from an assessment of all systems of the body. We find doctor's orders. This is a record of all orders given by the physician and the dentist. Orders are sometimes given as verbal or telephone orders to a nurse, and then they are transcribed to the doctor's order sheet. The physician or dentist given the order must sign the orders within 24 hours. All drugs in the category of narcotics, sedatives, tranquilizers, antibiotics, and cortisone products ordered for the patient in the hospital without limitation as to and time shall be called to the attention of the physician and dentist upon expiration of 72 or 96 hours by the nurse staff. The physician or dentist will reorder the drug change the order or cancel it. This is known as a stop order on drugs. We have progress notes. Progress notes give a pertinent chronological report of the patient's course and should describe the change in the patient's condition and result the patient condition from how often progress notes are read, such as if the patient is critically ill, progress notes may be written twice a day. Patients in the lesson stage, a progress note every day or every 2 days would be sufficient. The operative report. This should record a preoperative diagnosis prior to surgery. Operative report should be dictated immediately after surgery. It should contain a description of the findings, the technique used, tissue removed or altered, and the postoperative diagnosis. Ear or teeth, fragments of teeth that were removed must be sent to the pathological laboratory. 6. We also find other reports in the patient's record, such as laboratory reports, X-ray reports, anesthesia reports, a record of the patient's vital signs, and the nurse's notes. 7. If your patient remains in the hospital longer than 48 hours, a discharge summary or clinical resume will be required. This resume should answer 5 questions. 1. Why was the patient admitted to the hospital? 2. The pertinent findings such as laboratory and X-ray findings. 3. What was done for the patient while they were in the hospital? 4. Was the patient's condition on discharge? And 5. What were your instructions to the patient on discharge? All entries in the record must be dated and authenticated. Symbols and abbreviations may be used only when they have been approved by the medical staff and there is a legend to explain. The final diagnosis should be recorded in full and without the use of either symbols or abbreviations. The medical record is a property of the hospital. Information in the record is property of the patient. The hospital maintains the record for the benefit of the patient, physician and dentist, and the hospital. It is responsibility of the hospital to safeguard information in the record against loss, tampering, or use by unauthorized persons. The medical record department is required to maintain 4 different indices. First one is the patient's index. This is an alphabetical range of the names of the patient admitted to the hospital. This card has identification information of the patient and the patient's hospital number. Some hospitals place this information on the computer instead of using cards. The movement of the patient when they are admitted, so this information more quickly available. This information is really important as it does take the patient's hospital number. This is the key needed to locate the patient's medical record as they are physician's X. This is a alphabetical file by the name of physician or dentist. On the computer, the physician and dentist is assigned a number, and this is the way information is located on the computer. This index the record done by the physicians and dentists practicing in the hospital. It is strictly confidential. It is strictly a confidential record and should be kept from unauthorized inspection. Are now using the International Classification of Diseases adapted for hospitals. The 4th index is the Operation Index. All procedures are coded. Again, the majority of the hospitals are using the ICDA system. This is not an ideal system for teaching hospitals, but it is the only system that is being updated and kept on a more current basis. If you are interested in doing research on any particular diagnosis or operation, the medical records personnel can retrieve these records of all patients having this diagnosis or have had this surgery through these code numbers. There are several types of numbering systems that are used in hospitals. The first one is a serial system. The patient is assigned a new number on each admission to the hospital, regardless of the number of admissions. The number always being the next unused number in either the physician's registry or the number index. This means if a patient is admitted to the hospital on 5 different occasions, they would have 5 different numbers with 5 different records filed in 5 different places. I must say, very few hospitals are using this system at the present time. One of the other systems is the serial unit numbering system. In this method, the patient is assigned a new number on each admission to the hospital, and all previous admissions are brought forward and filed under the latest number. The ideal system is the unit system. In this method, the patient receives a number on his first admission to the hospital and retains that number on all subsequent admissions and in all departments of the hospital. In other words, all information on a patient is filed under this number in one folder. Then there are different methods of filing. The decentralized system. Under this arrangement, the inpatient and outpatient records have their own individual folders and are filed independently of each other. These records may be transferred from one department to the other, but then are returned to their original file after they have been used. This is not an ideal system. It is used in some hospitals, but it is fading out fast. Then the centralized system, and this is the ideal system. This is an arrangement in which all the medical records of a patient, whether inpatient or outpatient, are filed together in one centralized department. If you admit a Medicare or Medicaid patient to the hospital, the parameter length of stay will be stamped on the patient's medical record or on their chart folder. This parameter is determined by the admitting diagnosis, which you will be required to give when you call the admitting office and make a reservation for your patient to be admitted. This parameter tells you that Medicare will pay for the patient's hospitalization for that number of days. If your patient remains in the hospital beyond the length of the parameter, it will be necessary for a member of the utilization committee to review your patient's record to determine if further hospitalization is medically necessary. If a member of the utilization committee determines further hospitalization is necessary, the parameter will be extended. If further hospitalization is not medically necessary, the chairman of the utilization committee will write a letter to you, to the patient, and to the director of the hospital, stating that further hospitalization is no longer medically necessary and that Medicare or Medicaid will no longer be responsible for the patient's hospital bill. If you admit a Medicare patient to the hospital, the law requires that you record on the patient's record at stated intervals the reason why the patient is remaining in the hospital, the approximate number of days you expect the patient to remain in the hospital, and on discharge, whether the patient will be transferred to a nursing home or whether the patient will return to your office for follow-up treatment. Each hospital has many committees. 2 of these are the Medical Records Committee and the Utilization Committee. You may be asked to serve on one of these committees. The Utilization Committee is usually responsible for 1. The on-the-spot review during hospitalization to determine the medical necessity for continuing hospitalization. 2, they do retrospective reviews of admissions, durations of stay, and the professional services rendered. The Medical Records Committee assumes the responsibility for the medical audit function. The medical audit function may disclose problems in aspects of patients' care other than medical care, such as nursing, X-ray, and laboratory. In some of these studies, you may be asked to help establish criteria for a specific diagnosis. Then, the people, usually in the medical records department, will be requested to pull at least 100 cases of patients who have had this diagnosis. These must be patients in consecutive order and not skip around and pick the charts that you want to use in the study. They will be studied to see if they come up to the established criteria. If they do not, the information will be forwarded to the Department of Dentistry, and then it will be up to the chief of that department to make further studies of these cases. New government regulations will take effect shortly, and I'm sure there will be many more in the not too distant future. All this means an increase in the duties of the members of these cases. It is difficult work. It may be a little time-consuming, but you can endure it. There will be people at the hospital who will be happy to help you with these studies. And the last thing I would like to mention is, and it is a very important thing, the medical records administrator is not in the medical records department to nag you about completing your records. She is there to help you. If you have any questions, whatever, do not hesitate to ask her. She will do everything she can to help you get the job done. If you, as dentists, are low D's, you don't like it.